So the first thing I'm going to do is, of course, wash my hands, okay? And I'm going to put on some gloves. All right, I'm going to look at my order. And I'm going to make sure that I have an order for IV insertion. Typically, when we have an order for IV insertion, they want to give us the patient some fluids. So we're just going to look at our order. Okay, we got an order going on. Perfect. Now that we got our order, we're going to assess the patient if they have any allergies, okay? This is important, especially if they have any allergies to any type of contrast dye or anything, because typically in the IV kits, they might have some betadine or something in it, and we might need to replace it with something else, okay? All right, so now we're going to look at our patient. We're going to look at our site, okay? We're going to look for the color. We're going to see if there's any bruising. If they have bruising, hematomas already, we don't want to use that site, okay? Because that's just going to intensify the situation and cause even more sites of infection, okay? So now that we look at our site, we have everything right. We're going to make sure that we identify our patient. So I'm going to ask him, what is your name? What is your date of birth? Okay. Now we're going to get all of our equipment ready. Okay. So what we have here, we have our IV extension kit. We've got a flush. We have alcohol wipe. We have our IV start kit. Okay. And we have our catheter. And of course, when we have men, generally they have those super long veins, okay? So this little 22 gauge is not going to do anything. I never use a 22 gauge. I think it's insulting. I like 18. Okay. All right, so let's keep it moving. And I'm going to try to go up on your sheet. That way we can make sure that you guys can make sure that you're doing everything I'm doing. Okay. So sometimes in patients, we'll have to use like maybe a local anesthetic if they're really super sensitive. So we might apply like lidocaine, like a lidocaine cream or something. I've had to do that before to patients, especially the frail, older patients. They're really sensitive. So I've applied like lidocaine cream or something just to numb the area for them. But ultimately, that's what we have to do. All right, so let's see. We want to start over here. Okay, so anyway, we're going to select. We're going to see the side. Okay, we're going to use this arm. So now we're going to go ahead and assemble everything and get everything ready, okay? So we're going to open our packet. We're going to be careful. We're going to go ahead and pop our alcohol, okay? That way we can get it ready and nicely activated. All right, now we got our tape ready, okay? So I like to get our tape ready and like to put it right there in my hand. A lot of people like to put it on side of the bedside tables. That's a source of infection for me, so I don't do that. In nursing field, a lot of people do that. But, you know, it's a source of infection when you're putting tape onto a bed and then you're putting it onto a patient. Think about if that's not properly clean. You're introducing infection and microorganisms, okay? All right. So now we have our tourniquet. We have our site. So what we're going to do is put our tourniquet right on the arm. If I can get it on without knocking it over. That's a heavy arm.
Yeah.
Ooh.
They must have known.
What you bench? Like
I know.
300? Okay, what you bench? All right. All right, so now we have our tourniquet. And we don't do it really overly tight. If it was a frail patient, we would maybe put their sleeve over it so that way we minimize any bruising or additional pain. It can tight so tight that their skin, you know, could braise as well. Okay, so we have our outside here, or our tegaderm. We're just going to take that off and get it all ready. So we have our tegaderm, we have our gauze, we got everything going on. All right, we don't need the alcohol because we've already got that. So we have our stuff going on here. Okay, so now we're going to open up our extension kit. And while we have that tourniquet on, let's go ahead and clean our site because we don't want to have that tourniquet on that long. So we're cleaning it, and you see how we're cleaning in central circles around. So you go in and you go around, okay? All right, so we're done with that. Okay, so then what we do is connect our flush to the extension. And what I like to do is just go ahead and activate it so we prevent any air, okay, from going to the patient. Very important. Alrighty, so let's go ahead and get started. So we have applied our ChlorPrep. Let that dry a little bit. We have our vein nice and bounding and ready for us. Oh, this is a different one. Interesting. Okay, I'll roll with it. All right, so we want to make sure when we access the site, we're going to pull the skin taut. We're going to make sure that our IV is bevel up. Okay, bevel up. And then when we do it, we want to make sure we have everything ready and handy. I like to have my gauze right here because sometimes that could be a bleeder. Then you got blood all over the place, okay? So I need to put it right up here. All right, so we hold that skin taut and we just advance right in there. This is such a tiny vein, so we'll see how it works. This is a tiny needle, so we'll see how it works. All right, so as we put it in there, you see that blood return, right? Perfect. So what we do now is we get our stuff going right here, and you see how it blacks up in there and you can just have a mess. So what I like to do is hold it right above. That'll help stop the blood. I like to put my little gauze right up under there to cause any mess. And then we're just going to turn. There's some kind of retraction. I haven't learned that one yet. And then we're just tie that. And then we just insert it. And it'll look like this one is going crazy, but it'll be okay. So then we just insert it. We'll take off that tourniquet. And then we just flush. Okay? Because we already have that blood return right there and we're flushing. And then the only thing left to do, we're going to pretend that's in. And the only thing left to do is put our op site right over it, just like that. And then you can either make sure you clamp this. And then you can use your tape. And then boom. And that's all you gotta do. That's it. Easy, right? You see, mine raggedy, but it's okay. We get the idea. All right. So I have to figure out this one. I have never seen these before. So, have you seen these before? Yeah, these are. Yeah, this is new. This is a new one.
That's really round. Use the 22, 24 because of their veins are small, so that's probably.
Yeah, this one is a super coin. So I probably wouldn't use this one for these. Just FYI, when you guys are doing yours, I would probably use a smaller vein because these, you see how that's so, and it can bend like that. When you have a big, like when you get in a hospital setting, you have a big vein, you don't want to use a tiny needle. It just is no point. All right, so that's it. I hope this was helpful to you guys. Okay, perfect.
Thank you.
All right, now it's your turn. Let's get cracking. Oh, you know what? I gotta do my removal. Oh, let's remove. Yeah. All right, so easy with the removal. All I do with the removal is you know how you get there and there's so much tape. And then the skin is frail, like, oh my goodness, it hurts. Yeah. Alcohol is your friend. All you have to do is put alcohol here and that outside, and that tape will come right off. And it goes right here. Look, it comes right off. So you just get that. You see that hair, and you see that hair and that tape. Yeah, they crying. So all you have to do is lift up as you're lifting up. Okay. As you're lifting up, you go just like that. Just like that. And that'll prevent any type of pain to the patient. Just like that. Okay? And as you lift up, just be careful. You're just going to use that gauze and apply it right there. And we're going to keep using that alcohol to pull away. And then we just remove. Okay? And then, of course, we'll tape it. And then we're going to assess for any type of adverse reactions, any swelling, redness, anything like that. Okay? That's it. Now I'm really done. Okay. Thank you. Thank you guys
So
for
each one-
entertaining me.
So three of you are gonna be at, a table, and one of you are gonna be, kind of read the directions. We might have to improvise, not follow the directions, you might skip it, cause we're not hanging a bag. So we're just, the one person's gonna be the reader, and you kind of follow the lead of what they're telling you to do. I think I left the sheet on each page.
Yeah, we got one.
So you wanna move yours over?
When
so
you
they have
see it,
space
when you
over
see a
there?
vein, like you see like this bounding vein, it's so big. And you have to think about the IV and the gauge of it, okay? So the bigger the gauge, the smaller the needle, right? So you have a 22, use a 22 or 20 or 24 we use for pediatrics.
Okay.
And then something like a 22, we would probably use for older ladies who sprawl, have sprawl veins. But if you have something with a pretty good sized vein, you want to go with either 18 or 20.
Okay, so that's
Those
like
are
the
the,
average norm.
yeah, those are the norm. Like, you go to the ER, if you put in less than an 18, that's a sin. Like, what are you doing? Okay? Like, what are you doing? Because, and the thing is, when they come to the ER, they go through a lot of procedures. You know, they're going, they have a CT scan, they have this, and you have to have these bigger needles for this medication that we have to rush in.
Right, okay.
Especially if they're getting blood.
Right.
Because that medication will not, that blood will infuse in the 22. It will, but it'll be really slow, so we don't want to do that.
Thank you.
You're welcome.
Perfect.
Make sure that they're all, because unless somebody, you're gonna, like, a full response, you're not gonna do it with and see, here's a good,
Are you
find it, right, and then you wash your hands. Yeah. It says, identify the patient theory that assembly document, so,
This
get this
person has
out,
been stabbed a lot.
most of the 24.
Okay. Okay, so.
No, you don't need to, so they just put two of everything in here, you get this, and you get this. And so, what you're gonna do is try to check to see if it's like